Okay, this is a 360-degree view of the room. Okay. So I'm gonna come in and I am going to knock on the door and close the door for privacy, wash my hands and do some hand hygiene, introduce myself. Good morning, how are you doing?
Good, and you?
Good, my name is Nurse Brittany and I'm gonna be taking care of you today. I'm also gonna be doing a few assessments on you. What is your name and birthday?
Miriam Gonzalez, July 5th.
Perfect. Can I see your wristband to verify? Miriam Gonzalez, July 5th. Perfect. And Miriam, do you know where you're at today?
I'm at the hospital
Okay, do you know why you're here?
for a checkup.
Do you know what year it is?
2025.
Do you know what day it is?
Monday.
Perfect. Patient is well oriented and alert. Okay, before I get started, I'm just gonna ask you a few questions, okay? Have you had any past skin diseases such as allergies, rashes, hives?
No.
Have you had any bruising or hair loss?
No.
Have you had any like environmental or occupational hazards? Okay, perfect. So patient seems to be very well groomed and clean. Her stature is short, her body appearance is small, her mood is happy, and her speech is very clear and understandable. So I'm going to be checking your temperature real quick. The back of my hand. Okay, temperature is warm, but there seems to be no signs of fever. Her texture is smooth, her moisture is good with a radiant skin complexion. Her skin tone is tan. And now I'm going to be checking your skin turgor. This is to see if you're hydrated. Okay, skin turgor is good and retractable. Perfect. This concludes the general survey. Now I'm going to be moving on to your heart. Before I start your heart assessment, I'm also going to ask you a few questions, okay? Have you had any recent weight gain?
No.
Any swelling in your ankles?
No.
Okay. Have you had any chest pain or tightness?
No.
How many pillows do you sleep with at night?
Just one.
Do you urinate at night?
Just once.
Perfect. And do you have any history of heart disease?
No.
Does your family have any history of heart disease?
No.
Perfect. Okay, now I'm going to elevate the bed to 30 degrees. Now I'm going to ask my patient if she can tilt her head to the left side so I can see the right side to check for any JVD. There is no JVD noted. Now I would tell my patient to move forward a little just to see if there's any appearance, which there is not any appearance. Now I'm going to palpate her carotid artery on each side. We would do once on each side, not at the same time. Perfect. Carotid arteries are smooth with a moderate pulse. Okay. After palpating, I'm going to be auscultating for bruit, and I'm going to tell my patient to hold her breath. Okay, there are no signs of bruit noted. Now I'm going to be auscultating my patient's heart, and I'm going to be asking her to take deep breaths for me. So we do aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, my patient has a regular rhythm with an S1 and S2. Okay, after doing that, I'm going to be checking her apical rhythm, her apical pulse for 30 seconds. Okay, my patient has 68 beats per minute. Perfect. How do you feel?
I feel good.
Okay, good. Now I'm going to be doing a thorax and lung assessment on you. I'm also just going to be asking you a few questions, okay? Do you smoke?
No.
Do you have any history of upper or lower respiratory infections?
No.
Any history of lung disease?
No.
Have you had any coughing?
No.
Shortness of breath?
No.
Okay, perfect. Now, what I'm going to be doing now is I'm just going to be inspecting my patient. I'm going to be inspecting for symmetry to make sure that her chest and her anterior part of her chest and her shoulders are symmetrical. So everything seems to be symmetrical. I'm going to be checking for her breathing, which her breathing is normal and effortlessly. I'm also going to be checking for her APA ratio right here, which is 2:1. That's perfect. After inspecting, I'm going to be palpating for crepitus and also for tenderness. Does it hurt?
No.
There is no crepitus nor is there tenderness. Now I'm going to be also palpating for tactile epidermis. I'm going to do this and I want you to say 99, okay?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, tactile epidermis is equal bilaterally, which is perfect. Okay, so now after inspecting and palpating, I'm going to be percussing. Okay, resonance is clear, which is good. Okay, after percussing, I'm going to be auscultating in all 4 quadrants. I want you to have your mouth open and take deep breaths for me, okay? Okay, it is clear in all 4 quadrants, which is perfect. Now I'm going to be checking the posterior side of you. So if you don't mind sitting up, standing up and turning around. Perfect. Now I'm going to be inspecting. There are no lesions. Patient's skin color is consistent with genetic background. It is symmetrical. Patient's posture seems to be very relaxed. Okay? So now after inspecting, I'm going to be palpating, which I'm going to be checking for chest expansion. So just take a deep breath for me, okay? Perfect. Chest expansion is equal and bilaterally. Now I'm going to be percussing. Okay, resonance is clear in all 4 quadrants. Now I'm going to be auscultating. Take deep breaths, okay? Breath sounds are clear in all 4 quadrants and lungs. Okay, you can sit down for me. Perfect. Now I'm just going to be monitoring my patient's respiratory rhythm. I'm just going to be measuring it for 30 seconds as well. Okay, I got perfect. I got 8 times 2, which is 16. Okay, that concludes the thorax and lungs assessment. Now we're going to be moving on to peripheral. Okay, so I'm also going to be asking you a few questions. Have you had any leg pains or cramps?
No.
Any sores on your arms or legs?
No.
Any skin changes?
No.
Okay, good. Now I'm going to be checking your pulses. First, I'm going to start off with your radial pulse. Radial pulse. Your ulnar. Well, I would do 1 at each time. Wow, you have a strong pulse. Radial. Let me see. Okay. Ulnar. Brachial. Okay, and usually I would do femoral, but I'm not going to do it for certain reasons. But just so that you know, it's going to be in your groin area, okay? After doing your radial, ulnar, and femoral, not femoral and brachial, I'm going to be doing your popliteal, which is going to be behind your knees right here. Okay, I'm also going to be doing your posterior tibialis, which is going to be over here by your ankle, your dorsalis pedis. Okay, all pulses are smooth. Okay, perfect. Now after that, I'm going to be checking your radial pulse for 30 seconds. Okay, I got 30. Now after doing your radial pulse, I am going to be checking for, to see if you have any, to check your capillary refill on your fingers and on your toes. Okay, capillary refill is less than 3 seconds, which is very good. Now I'm going to be checking for pitting edema, which is going to be on your foot and on your ankle. Let me check this one. Okay, there is no pitting edema, which is great. Okay, now we're going to be doing an abdominal assessment, okay? Now I'm going to also ask you a few questions for this one. Have you had any nausea or vomiting?
No.
Any pain in your abdomen?
No.
Difficulty swallowing?
No.
Any changes in appetite?
No.
Not at all? Okay, good. Okay, now I'm going to have you lay down at a 0-degree angle on the bed. Okay, now, if you don't mind if I lift this up a little bit. Okay, I'm going to be checking and inspecting to see your skin tone, which is a tan, but it is consistent with genetic background. Your contour, which is flat. Your contour, which is flat. There are no lesions or anything. So now after inspecting, I'm going to be auscultating in all 4 quadrants for bowel movements, okay? And I'm going to do it with the diaphragm first. There is bowel movement in all 4 quadrants. I'm also going to be checking with the bell real quick just to see if there's any bruit. Okay, there is no brewing noted. Now after doing this, I am going to be percussing for tympani in all 4 quadrants. And I'm going to be going at a zigzag angle. Tympani predominance in all 4 quadrants. Now after doing that, I'm going to be palpating and I'm going to be going superficial and deeply. Superficial first with one hand. Now I'm going to be going deeply with 2 hands. And I did this to check for masses or tenderness, which there is not any. Okay, now after palpating and percussing and auscultating and all of that, everything's good right now. If you don't mind standing up, I'm just going to see if you have any CVA tenderness. And you can just turn around like this. Perfect. And I'm going to be doing it over here, like over here where the kidneys are. Okay, and there is no CVA tenderness. Thank you. Thank you for helping me.
You're welcome.